Hello, everyone. I'm Sherry with the CGH Health Foundation. Welcome to our Growing Healthier program for April. This is an educational series that's sponsored by the CGH Health Foundation. In our Growing Healthier programs, we educate you about important health topics, and it also gives us a chance to introduce you to some of our very knowledgeable health professionals. Our programs are hosted by Dr. Bill Bird, our Chief Medical Officer at CGH. Today's program is going to feature Dr. Ian Baer, who's a new addition to our general surgery and endocrinology department. Dr. Bird's going to talk to him about some of the surgeries that we do commonly and also about head and neck surgeries, which are Dr. Baer's specialty. At the CGH Health Foundation, our mission is to support healthier lives for people in our communities. And we do that by funding several initiatives, everything from free mammograms for women to eyeglasses for kids, services for our patients that have dementia and their caregivers, medication assistance, transportation assistance, mental health program and services for not just our patients, but for kids in area schools, our therapy dog program. We have so many initiatives, and the money from those initiatives come from donors like you and also from our various fundraisers. And so we have a fundraiser coming up. We're asking you to bloom and grow with us in our spring auction. And this is a virtual auction, so you actually go online and view our offerings and make your bids. And it is going to be live and ready for your bids from May 1st through May 6th this year. And so watch for that. If you haven't already liked the CGH Health Foundation Facebook page, go ahead and do that, and you'll see the latest news and information there. Make sure that you put next month's Growing Healthier program on your calendar. We have a new provider in our sleep medicine department. That's Dr. Brittany Monceau. And so she will be here to talk to Dr. Bird about the importance of sleep for our health and for our safety. And that program is going to be on May 1st here on Facebook Live at noon. And Dr. Bird is waiting out there in the wings to talk to Dr. Baer. Are you ready, Dr. Bird?
I'm ready as always, Sherry. I'm at your bid and call whenever you tell me. I'll do my thing. Hey, welcome everybody. This is Bill Bird, as advertised. I'm the Chief Medical Officer here at CGH Medical Center. And thank you for taking the time to listen in to this interview that I'll be having with Dr. Ian Baer, a new general and endocrine surgeon here at CGH. And Dr. Baer has been here since beginning of March and has already made a nice splash and a positive splash into the medical staff here at CGH. So without further ado, let me pull in Dr. Baer. Hi, Dr. Baer.
Howdy, how's it going?
Good. Long time no see. We ran into each other yesterday.
We did, yeah.
Dr. Baer has been busy this morning doing surgery, so now he's kind of hanging out before he sees a few patients, if I understand that correctly.
Yeah, so I had a surgery, saw a few patients in clinic, and then have some more clinic. So.
All right. Well, thank you for taking a little bit of time to talk with me and answer maybe a few questions. Are you ready to go?
Yep, absolutely. Ask away.
Okay. I thought we'd start with something that folks tend to want to know about new medical staff, new doctors here in the area. Tell us a little bit about yourself.
Yeah, so I was actually born in Chicago, Cook County Hospital, but I grew up in Rockford, so not too far away. And from Illinois, I kind of transitioned over to Michigan for a large part of my education. Went to a small college called Kalamazoo College. I played tennis in college, and actually was a doctor from my hometown who played tennis there as well. Kind of encouraged me to go there. Because they had a very strong pre-medical program. I come from actually a family of doctors, so I'm a third generation surgeon. My dad and great uncle were both orthopedic doctors, so bone doctors, kind of here in Rockford in the northern Illinois region. But so that I ended up for college in Michigan, medical school at Wayne State in Detroit. I did my general surgery residency at Michigan State University, and then I did a fellowship specializing in head and neck endocrine surgery at Harvard out in Boston.
That sounds like pretty reasonable training to me. You hadn't mentioned about you said your uncle also was is also an orthopedic surgeon?
Yeah, well, so my great uncle was
Great.
the first orthopedic surgeon ever in Rockford. My dad is an orthopedic surgeon, and then I actually do have an uncle, my dad's brother, who is also an orthopedic surgeon, but he lives in Atlanta. He's not
Okay.
in this region.
So are you kind of the black sheep of the family? That you're not an orthopedic surgeon?
Yeah, I get asked that a lot. I thought I wanted to go into orthopedics. It's a great field, but I kind of fell in love with the head and neck and general surgery. There's a lot of really cool things as general surgeons that we do, including robotic surgery. The anatomy is kind of a little bit more meticulous and fine detailed. I don't like to call them the carpenters, but I consider orthopedics kind of the carpentry of surgery, which is fun in its own right, but not kind of what's appealed to me the most.
Yeah, that makes sense. Yeah, that sounds good. I didn't know you were a tennis player either.
Yeah. So I played tennis through college. Don't play nearly as much now. I play more golf now than anything.
Okay.
But yeah, I played tennis up through college. A very strong D3 tennis team at Kalamazoo College.
Okay. Have you made your way to Westwood yet?
I have. Yeah, no, it's a very nice facility. They've got some nice courts there. Yeah.
Yeah. Well, speaking of which, I wanted just to kind of also ask you, what have your impressions been of, I guess, Sterling, the community, the hospital, everything about the area?
It's been great so far. So I bought a home in the Rock Falls area, dealing with some home renovation stuff. So I'm not 100% moved in yet, but everyone's been super welcoming since I've been here. The hospital facility is great. The hospital has been very supportive. The staff's been excellent, easy to work with. As easy of a transition as I could have hoped for. Yeah.
Good. Yeah. And as I said, I have a pulse on our medical staff and what happens here in the hospital. And I will tell folks who are watching this that Dr. Bear has already made a very positive impact in terms of the care that we're able to give our patients here at CGH. So, yeah, Neil is pointing big time up for Dr. Bear. Hey, speaking of that, I'm going to start with the endocrine side of things of what you do, because you mentioned that was one of the things that really got you excited about not doing orthopedic surgery. So let's start talking about that. And what are the type of patients, Ian, that would need to see an endocrine surgeon, and what type of surgery would you do to help those patients out?
Yeah. So in terms of endocrine surgery, what does that mean? That means I specialize in the thyroid in the neck. What are called the parathyroid glands. They're little pea-sized glands the size of your pinky nail that live in the neck also, that control our calcium levels. And oftentimes people don't realize it, but they can have high calcium, which can cause very common things like joint aches, muscle aches, fatigue, constipation, brain fog, osteoporosis, lots of things by these little pea-sized parathyroid glands. And so if there's an overactive gland, I remove it. In terms of the thyroid, people often have thyroid nodules. Actually, half of us in the country have thyroid nodules. And with more of the imaging going on these days, CAT scans, x-rays, things of that nature, a lot of them are being found incidentally. And so, oh, you have a thyroid nodule. And so, getting that looked into with an ultrasound is something that we do here in our office. If they're big enough, sometimes they need to be biopsied. We also do that here in the office here, just to make sure that, heaven forbid, there's nothing like a thyroid cancer there. A big thyroid, what we call a goiter, can often hide in people's necks underneath the muscles, but can be squeezing their windpipes or their throats and cause difficulty swallowing and breathing more than people realize. And then the other thing in terms of endocrine surgery is our adrenal glands, which live in our belly above our kidneys. And those adrenal glands make lots of hormones in the body, and sometimes they can be overactive, those adrenal glands, or have a tumor that makes too much hormone or a growth there that needs to be removed. So as an endocrine surgeon, I help with that as well.
On the parathyroids, which sit on top of the thyroid gland, You were also mentioning, I thought this was interesting, something, can you talk about how that affects how a bone heals after a fracture, and what orthopedic surgeons need to be aware of in terms of that?
Yeah, no, that's actually a great thing to bring up, because I'm working on a research study with some orthopedic surgeons. And what we found is that some patients who have what's called a non-union, when their bones don't heal the way that we want them to, we've been testing their parathyroid levels, and a lot of these people have a overactive parathyroid gland, what we call hyperparathyroidism. And so what that's causing is calcium to be sucked out of the bones, and the bones don't heal. And so I operate on those people and take out the parathyroids in their neck, and their bones heal. So, me not being an orthopedic surgeon, I actually still fix bones in a way. And so that's actually a study that I'm working on with some orthopedic surgeons, and it's going to be coming out hopefully soon here in a paper. But kind of a big deal, because there's quite a few non-unions, hundreds of thousands of them throughout the country every year. And if we can get people's bones to heal and prevent them from having to have multiple surgeries on their bones, then that's great.
Yeah, good point. On the thyroid side of things, you mentioned it, like the imaging these days is better than it used to be in terms of identifying thyroid nodules and those type of things. And I think I've read where perhaps even the incidence of thyroid cancer is up because we have a better way of identifying and finding those cancers. How do you, when patients see you, how do you decide what thyroid nodules really need a little something done, or can just be watched and waited? And the same, I guess, even for people that have thyroid cancer, is it always something that you do something about, or sometimes do you do kind of watchful waiting for that, Dr. Bear?
Yeah, no, those are great questions. So there's a scoring system called a TIRAD score that our radiologists use, and I use as well, that takes an ultrasound of the thyroid and can kind of characterize the risk of, heaven forbid, there being a cancer in a nodule. So it takes, the size of the nodule, if it's irregular, if it has any calcium spots in it, and it creates a score that allows us to determine if a biopsy is needed.
Okay.
And we do have people who have thyroid cancer. The most common type is called papillary, and it tends to be really slow growing and not aggressive, thankfully. And so, where I trained out at Harvard in Boston, we had a program to watch people's cancers, and only if those cancers changed in size would we then do surgery. So that is something new that wasn't around in the past, in terms of what we found through our research, that there are some people who can be candidates for watchful waiting. Other people elect to have surgery, and that's okay too. But I go through all of those choices with the patients to make sure that they have every option available to them.
So you will follow folks along then in certain situations if they have thyroid nodules that are questionable, or maybe they have a watch and wait type of cancer. Tell me about like how that works between you and our oncologists for patients who are identified with cancer.
Yeah, so it's definitely a team effort. Most hospitals, this hospital included, we have what's called a multidisciplinary a cancer team, which is the best way to approach any patient's cancer. So it's not just one person, it's a team of people managing cancers, thyroid cancer included. And so it's a conversation with me and the other physicians who the patient has in their team. So whether it's the primary care doctor, whether it's a endocrinologist, whether it's a oncologist, there is a teamwork approach to it. And I am very happy to kind of make it unique to every person in terms of what works best for them too. But ultimately it is a conversation between multiple people.
I don't know, I'm curious. You mentioned that you take out also patients who have goiters, so thyroids that are really big, and can actually affect someone's ability to swallow and or breathe. Ballpark, what's the largest thyroid you've taken out?
Oh man, the biggest was extending from someone's chin down to below their collarbone. So and both sides. So it looked like they had a big watermelon coming out of their neck. And interestingly, they came in not for their neck, but because of arm swelling. Their thyroid was so big that it was squeezing a blood vessel in their neck and created a blood clot in their arm. And so they came in for arm swelling. And so we took out actually just half of the thyroid to release that pressure at that time. And yeah, it was the size of a football, I would say.
Wow. Yeah. So interesting. They got used to what their thyroid was, but really what got them into you was something that was kind of, it was a result of, but not exactly the thyroid itself.
Yeah, there are some people who don't want to see doctors, and that's okay. You know, they each their own. But I encourage people not to wait. The bigger your thyroid gets, the more complex it gets, and you don't want to wait until you can't breathe. Ideally, you want to take things out before you have breathing issues, before you have swallowing issues.
Yeah.
Ultimately, in the most complex cases, people's chests have to be opened, have their thyroids removed.
Wow. Okay.
That really changes what kind of operation they have to have.
Yeah. I'm going to transition. Anything else you want to say about endocrine surgery, Dr. Bear?
I mean, there's a lot that we can talk about. Endocrine surgery, even the world of thyroid cancer is really changing. There's a lot of really cool research out there, and specifically what we call targeted therapies. So these days in the world of cancer as a whole, there's a lot of looking into the genetics of cancer and what genes are being changed in these cancers. And what we've found is that there are genes and specifically chemotherapies and medicines that can target those genes to treat people's cancer. And I even, in my own experience, I had a patient with something called anaplastic thyroid cancer. Really aggressive, really nasty, and it used to be about a 3-month life expectancy from the diagnosis. Nowadays, with treatment, people are living years after diagnosis. And I had a patient who came into me with it, and thankfully I was able to do surgery. He had metastases to his lungs. We gave him targeted therapy, and it melted them away. I've seen things like that until just recently. We didn't have technologies like that in the past.
Yeah.
So targeted therapies, thyroid cancer specifically has lots of targets that we're finding, and more research is coming out every day about it.
Yeah, that's very cool. In some ways, certain types of cancer are almost turning into chronic diseases.
They are, yeah, absolutely.
Yeah, that's really encouraging. Well, let's transition now to general surgery, because you're also a general surgeon.
Yeah.
And so talk a little bit to the folks who are watching here. What kind of surgery does a general surgeon perform? And how do you kind of take care of all the surgeries that come to CGH in terms of yourself and then the rest of your team here?
Yeah. So general surgery is anything from having to have your appendix taken out to your gallbladder, a hernia repair, a lump or a bump on your skin, colon cancers, kind of a whole broad spectrum of things that people come in for. A lot of it comes into the emergency room. So myself and my two partners, Dr. Wakefield and Dr. Kennedy, are my two partners here in the general surgery team. So anything that comes into the emergency room, we help with. I am trained on what's called the Da Vinci robot, but that's just something else in terms of as a general surgeon. I have specialty training in so that you can do things what's called minimally invasive. So little incisions the size of a pen or your pinky instead of a big traditional incision. We can do lots of things in a minimally invasive approach, which is a faster recovery for patients. And it's a really cool tool to bring to the hospital here and to the community to help people in some of the most modern surgical ways possible.
Yeah, very good. And then my understanding is on the breast cases that we tend to have Dr. Wakefield and Kennedy take care of those in general.
Yeah, so not that all female surgeons prioritizing that, but a lot of female patients like to have women see them, and the fact that we have two female surgeons here is awesome. And so they are kind of leading the way in the breast surgery. I'm happy to help people if they want me to, but at this point, I'm deferring most of that care to Drs. Wakefield.
Yeah. It seems like I mean, I guess the reality, we were already talking about cancer care. It just seems like that all the medical specialties continue to evolve and change, and which is great. In your career, even, how has general and endocrine surgery evolved from when, let's say, you were a medical student?
Um, so I mean, a lot of it is minimally invasive, is something that um, is more and more on the forefront. People used to have big incisions all up and down their belly for some of these operations, and now they can do it with these little, fingernail or finger-sized incisions in their bellies. So that is definitely something that is taking over, is minimally invasive surgery. The other, which I mentioned before, is the targeted therapies for cancer cases. There are now lots of different targeted treatments which are available, which weren't available in the past. Um, and having things more readily available. I'm very thankful for the training I had out at Harvard and Boston, which is, in my opinion, one of the best places in the world to go. But the care that you would get there is no different, thankfully, than what I am able to offer at the hospital here. And so being able to keep people in the community and not have to travel a distance to seek care and have the same care that they would get somewhere else, I think is something that may not have been available in the past, and I'm happy to bring some of those specialties to the community.
Yeah, very good. Yeah, it's great to have what you do, and for patients to have them be taken care of. How would a patient go about getting in to see you, Dr. Bear?
Yeah. So multiple ways to do that. In terms of insurance companies, sometimes you do have to have a referral from your primary care doctor. Now, you can always call our surgical office and our surgical center and request an appointment for me. I'm happy to see anyone. Again, for some reasons with insurance companies, there are, unfortunately, some hurdles we have to get around to make sure that people don't get bills because it was something that wasn't through insurance. But yeah, you can call our office, your primary care doctor, our websites. I've got a website out there with some of the information about what I do as well, that has our office number on there. So multiple ways to reach out to us and get into an appointment.
Yeah. One of the things you just mentioned, just for folks who are, if they're interested in trying to get an appointment with you, one of just the little things that's it takes sometimes a few months to get everything hammered out, is insurance companies, what's called credentialing for new physicians, not just Dr. Bear, but anyone. If you have a certain types of private insurance early on, the insurance company may not have what's called credentialed you yet. So be patient if you're someone who is in that boat. Dr. Bear, all the insurance plans that all our other doctors here at CGH take, Dr. Bear will take, but there are typically, and particularly with private insurance, not Medicare or Medicaid, there can be a bit of a lag from Dr. Bear showing up to that insurance blessing appointments with Dr. Bear. And so we're still working through that process, but anticipate that sometime here in the near future, that'll all be smoothed out as well. Well, Dr. Bear, it's been a pleasure chatting with you. Any other closing thoughts that you want to share with the folks who are watching?
No, just it's a pleasure to be here. It's been really nice being part of the team already. I can already tell that CGH is a great place to work. The community is a great place to live. So I'm happy to be here.
And you know what? We're very happy to have you here. So thank you for that you're here, and thank you for taking some time to chat with me about some things related to endocrine and general surgery.
Absolutely.
All right. Take care.
Yeah.
All right. So that was Dr. Ian Bear, and glad that he had a chance to chat and to be interviewed. Yeah, if you thought this was helpful, or have other folks who you think might want to find this helpful, please feel free to share this with others. I do have a couple slides that we just want to show you before I sign out. So I want to congratulate Joe Clemson, our Employee of the Month. He works as a biomedical technician here at the hospital. Joe's been with us for a long time, and he does great work. And so I'm very happy and very much deserved award to Joe. And yes, and as Sherry mentioned at the beginning of this broadcast, we'll be having Dr. Brittany Monceau here next month to talk all things sleep, which I think you'll find very interesting. And there's always coming out information about getting good sleep is so helpful for your overall health. So we'll be talking about that with Dr. Monceau. Okay, well, thank you for taking the time to watch this. Until next time, thanks, and we'll be seeing you soon. Bye.